So Adelina Comas-Herrera, I'd like to welcome you to this webinar of the Global Observatory of Long-Term Care. I will start by introducing the observatory in case you are new to it, so you understand where you're at. And then we'll hear about the social protection in Southern Africa intergroup. So to introduce the observatory, I'll just share some slides that some of you may have seen before, that hopefully by now you'll know it very well. The Global Observatory of Long-Term Care is an online platform that we created with the purpose of sharing cross-national experiences on long-term care, realizing that there are many shared challenges and that we can learn from each other on how different countries and localities are addressing them. We can share research evidence and facilitate collaborations. And this is open to everyone, from policymakers, industry, advocates, care professionals, and academics. If you want to engage with GOLTC, the most important thing to do is to become a member, and that is free and is open to everyone. And once you do that, then you can join the interest groups like this one that you're interested in. And there you will find people with similar interests, and you can also share publications and events. And we're very happy to share your work and your knowledge through topic guides, country profiles, methods guides. We now have more and more blog posts as well. And of course, you can come and give presentations. This is where you can find a link to join, and my colleague Nas will also be sharing that in the chat. And just to mention that our next two webinars are on quite a different topic. The first one is on enhancing care home quality using wearable tech and social network analysis, and that's a study from the UK. And then we'll have one on rehabilitation services for young onset dementias with examples from a mixture of countries, including Brazil, the UK, and India. So I hope you enjoy today's webinars. I hope you join us for the future ones, and you consider joining us as a member of the observatory. And now I'm very happy to hand over to Professor Elena Moore from the University of Cape Town, who will introduce the GOLTC Special Interest Group on Social Protection in Southern Africa. All yours, Elena.
Thanks, Adelina, and good afternoon, everyone, and thanks for joining us again here. We are the Special Interest Group entitled Social Protection for Older People in Southern Africa. This is our fourth and actual final webinar for the year, but we will be continuing next year with a series of webinars, so stay tuned for those. They'll be advertised shortly at some point. So I'm delighted today just to say a little bit about the Special Interest Group. Really, the understanding of social protection vis-a-vis older persons in the region has had a particular focus historically in the literature review, and has actually pretty much overlooked the role of family caregiving and a connected kind of thinking around the care needs of older persons and family caregivers. And so that's something we want to pay more attention to over the next couple of years, and how that links into the broader social welfare kind of programs and scheme in the region. I run a program called the Family Caregiving of Older Persons in Southern Africa program. It's a 4-country-wide study. And so we're trying to do a lot of that work and gather that evidence and converse with NPOs, government officials, civil society in doing that work. So we've been hosting these seminars to get speakers, for international speakers, but also local, national, regional speakers, to get us thinking around, obviously, the challenges around elder care, but also some of the lessons that we've learned more broadly about social protection, advocacy, activism, and promotion for not just for older people, for other persons and other vulnerable groups in the region. So today we have two excellent, prolific speakers talking more broadly and more conceptually, I would say, around the kind of what we could imagine as the challenges for elder care as this group in society grows will obviously grow over the coming years. So first up we have Professor Marianne Ulriksen. She's the Associate Professor at the Danish Center for Welfare Studies at the University of Southern Denmark and Center for Social Development in Africa at the University of Johannesburg. She's written widely on social welfare more broadly in the region. It's got a range of fantastic texts and articles in this regard. Either she or we can share some of those in the coming, today or thereafter. And today she's going to be talking about Rethinking Rights and Duties from the Perspective of the Elderly. So that's thanks, Professor Marianne, for being here and for sharing your work with us. The second speaker is the notable Executive Director of the Social Policy Institute and has worked tirelessly and for a long time in advocating for and fighting for basic income grant, amongst many other issues here in South Africa. So today she's going to talk about the care for the carers, reflection on social security policy as a lens for understanding the landscape of social services reform in elderly care. It's Isobel Frye, everybody. She is very well known nationally for all her contributions in this area, and I'm delighted to have her here today. And so what we'll do is we'll have the first speaker for up to half an hour, or as long as you need, up to a half an hour, but no more than half an hour. If you need 20 minutes, that's also fine. And the same then, Isobel, for yourself. So we'll do the two talks back to back, and then we'll open it up for questions. Obviously, people can put their questions in the chat as they hear things and think of things. And then we will have a good 20 minutes, I'd say, if not 25 minutes, for a discussion towards the end. So thanks again to both speakers. Thanks again to Adelina and the GOLTC team for having us all here today. And I'm going to hand over, Marianne, if you would like to go first, and if you're okay with sharing your own slides. If you need us to share them, we can do. But if you want to share them yourself, fire ahead. Thanks, Marianne.
Thank you very much. Thank you for inviting me. I've been looking forward to this. And I hope you can see the slides fine. Right, so as mentioned, I'll talk about rethinking rights and duties from the perspective of the elderly. In doing this, I will be talking about a paper that actually is 10 years old now, that I wrote with a good colleague at the CSDA at UJ, about thinking around rights and duties and the role of social protection herein. And the reason I do that is because when I was contacted by the Observatory and Elena and colleagues, I was a little bit skeptical because I have not really done much with a focus on the elderly. But I am actually really excited about this opportunity because I'm hoping that this can spark some interesting discussion and that you might find this helpful in working with elderly and care for elderly and all the different dimensions with that population group. So here are some of the sort of overall points that I'll be making coming first of all from the paper, and I'll obviously be elaborating on this. But the one is that the reason we started this paper was that we felt there was often a very unbalanced view on rights and duties. I mean, either it was about citizens being rights holders and the state providing for those, or it was about some citizens being asked certain duties. So we were looking for some perspective that would allow a bit more balanced view of rights and duties. Into this also, that reason for it, you could say also, is because of a view of seeing citizens as both productive and vulnerable at specific times of your life, but it can also just be at various moments. And in the paper, we're not looking at generations, but we were more looking into the distinction that we found unhelpful between looking at distinction between who are poor and who are not poor, and thinking that that would require different social protection for these two groups of people, whereas we were more thinking we need to break that distinction because social protection can be helpful for across, basically, because your level of productivity and vulnerability can definitely vary. So the generational aspect will be coming in later, because this is what this presentation pushed me to do. In our argument, we also say that citizens are productive and vulnerable. Citizens have both rights and duties. So we make that argument, but we also make an argument that even given that we're all agents, there are some limitations that does make it harder for poor people or more vulnerable people to be duty bearers. So I'll elaborate on that as well. And then at the end, saying a bit about how I think it might be helpful to add this generational dimension to this framework. And basically ending with some questions, because as I think you're more the experts, so I'm very curious to hear what your thoughts are around this and how we can look at this with the idea of duties. So just saying that, of course, we build on existing literature and we criticize the literature, some existing literature in the article, but we also gain different perspectives from the existing literature. So from the human rights perspective, we sorry, I'm struggling to place the pictures of everyone in relation to the screen. Okay, so from the human rights approach, we are a bit critical because we found that it's very much on rights and not so much on that what citizens might also be doing or people might be doing. But what we do found is useful was this perspective that, as it's stated here, duties should not be corrective stipulations. What thinking about could be an example as the conditional cash transfer, where you have social or policies where some citizens are given specific duties because there's some kind of mistrust that people will spend the money well. So this kind of critique of duties we found very helpful. Then from the capability approach, we find it useful that the argument that since people are both capable and needy, the balance between being a rights holder and a duty bearer can vary over time, and also by implication that one is rarely solely one or the other. I mean, one is often doing some kind of duties and having some kind of rights in an interesting mix over time. From the social contract theory, we also drew the inspiration that we think it's constructive to view rights and duties as existing within a nation state, where citizens relate both to the state and fellow citizens in a constant exchange of giving and receiving. There's also a critical leg into this theory, where we also found it helpful, the warning against any framework of rights and duties that entrench existing power structures of domination and oppression as much as that is possible. So we found these perspectives useful, but we also argue that they don't hold an entirely balanced view on rights and duties. Either the focus is on individuals as right holders, or alternative on the enforcement of duties as a condition for the provision of entitlements. So into this we kind of follow with what is our gist of our argument. And we argue for that rights and duties should be seen as a generalized exchange, in a sense that you should not look at a duty one-to-one to a right. We can fulfill duties at certain times and gain rights at other times. So we would look more at rights and duties in a more broad perspective, and not expecting, I do this and therefore I get this in return immediately, but more that over a life cycle and in a community, in a state, the rights and duties are exchanged at given times and when it makes sense, but you will always be gaining something in return sooner or later. Obviously, there is some challenges in achieving this state, but the point of it being is that this is a way of breaking up the sort of distinction between different groups of people as well. And also we believe that the sort of long-term sustainability and possible expansion of social rights is more likely to be achieved in a context of citizenship as generalized exchange, where all citizens perform duties and benefit from rights. So whether basically we argue that whether conscious or not, citizens act as agents and duty bearers, often without maybe really thinking about it. There's a range of duties that we just do, and many of these duties are fulfilled by poor and non-poor alike. And we have a table, and it's not complete, at all. It was just a way of trying to think around various types of duties that one can be performing within the sort of the realm of social duties, participation duties, legal duties, and political duties. We draw from other work, but we sort of build on it. And obviously, there's some of these that can be fulfilled, often maybe not even thinking that it's necessarily a kind of a type of a duty, and also can be performed by most people. For instance, be informed and exercise electoral franchise, respect others' right to liberty. So there are elements where this is a kind of duties that people can fulfill. But we also make the point that there are structural limitations to poor duty bearers, and the reason why this is important is because it can be easy to say, oh, but someone doesn't do anything, they're lazy, they're not trying hard enough, which can be a misunderstanding, because maybe it's not actually as easy to do this thing as a privileged person might think. In the article, we draw from other work around sort of the vulnerable people's default position, which is that they are in a default position is that they are worse off by not doing anything, whereas well-off people don't have to think about doing anything. So the example, an easy example to understand, could be access to clean water. So a wealthy person will access water by opening the tap and get clean water that way. A poor person in certain context would have to do a lot of activity in order to have water that is clean to drink. You know, you have to maybe pick it up somewhere, and you might have to clean it in various ways. So we can also think this in terms of being a duty bearer. So an easy example again is being a taxpayer. If you are working in a formal sector, in a formal job, your tax is deducted from your salary. You have to do a tax return, which is irritating, but not overly complicated. But if you work in the informal sector, you don't have the means to do that, even if you wanted to. Even better example could be social insurance. So you often will have that with a formal job. If you are in an informal job, particularly in a low-paid informal job, you will have to do something specific to live up to this kind of duty of providing resources and contribution in varied forms of social rights. So there are a range of duties as we see it. Many are performed without us thinking much about it. Some are easier if you are in a more privileged position to provide for, and others might also depend on where you are in your life cycle, and that's where we will start to move into to this kind of talk today. Because the obvious way to think about this is that the different weights of rights and duties over time, and we don't really spend much on that in the articles, which is you can talk of as maybe a criticism, or maybe it just wasn't really our focus. But I think it obviously makes sense for all of us that that some duties are more profound in the middle age of people. You know, jobs and caring for others, raising a family, is something that is not necessarily for the elderly and not for the young, at least in an ideal version, right? And then there are, of course, other kind of duties that can cut across generation. We can all respect others, and children can also contribute to chores in the household and so on. So, but there's definitely a value, I think, to thinking around that there is a differentiation between different generations in terms of the types of duties that, in the ideal, we would think would make sense. So basically, the elderly, you would weigh it up against, in the ideal world, that they would benefit from more rights in the older times, in the older ages, because over the years they have been doing a lot of duties to build that up. But that's of course sort of in an ideal sense. So you can take the one example I have here, where I think we really sort of put it into a stark perspective about this possible unbalance between rights and duties for some elderly people. This is in the context of South Africa, but of course it could be in other contexts as well. I didn't get very far in this, but I did do some interviews with child caring grandmothers because we were kind of interested in understanding their views on rights and duties as being grandmothers taking care of a child or children from which they were also getting the child support grant, but also getting a pension. And I said it was only a few focus groups. I didn't get as far in this as I'd hoped, but I think this is kind of useful today to sort of make an example of the challenges of finding a balance between rights and duties, and maybe the framework helping us to see this unbalance. So here we asked the women, the grandmothers, why they were taking care of their grandchild or grandchildren, and they, in various comments, but it came a lot around seeing it as the duty, and because the mother is not around, or who else should be doing it, kind of argument. So they would take on this responsibility, but pretty much also because they didn't see what other options really would be there. And this also came for them with a lot of worries, obviously, about their own situation and how they could cope in time, and what if they came into a position of needing care. So I don't think, I mean, they were very sort of, I don't think that they were very sort of, this is of course what we do, we'll take care of our grandchildren. But there was obviously a lot of worries around that as well. And then we talked a little bit about getting the pension, and it was nice to see that I had a strong sense of their rights to the pension. They say pension is ours because we pay tax. So they had a good sense of that. But then when we talked about sort of sharing the pension with others, they were not actually so keen. And I mean, this is not a big study. It was some 4 focus groups I had thinking of it. But they sort of, in a way, were not so happy they had to share it so widely. But they felt they had to because there were really no other option. So I think from this sort of framework with the rights and duties, I think it becomes very clear that we have group here, grandmothers, who we would be thinking would be at a time in their life where they could be enjoying various rights, and at this point also already having done many duties, but we end up in a situation here where they are still continuing to perform several duties. I put them here from the table. I mean, pursuing healthcare and education and raising a family, which often we would put in with the sort of the working age population rather to be doing this. So basically, this has made me sort of reflect a bit on this framework, and this is I'm very excited to hopefully hear something from you around how you might view this, given your expertise with this generation. But some of the questions I asked myself was this, of what we already talked about, that there are different weights of rights and duties over time, and maybe we have not, or I have not maybe come across much that has this kind of focus. Also that we should appreciate more the many duties we perform. I think if one talked or was more conscious about what is actually done, maybe there was being a bit less criticism of people claiming rights, because it's a bit like that's, it's, but you're just claiming, you're just asking for, but actually people are doing very many things. It's just not often considered, which basically would strengthen the argument of making the elderly legitimate right holders. I wasn't sure legitimate was the best word, but I hope you bear with me on getting what I'm thinking here. But basically acknowledging that the people have been doing many things over a lifetime, and that has been helpful for them. And then it relates to that. I'm jumping to the last one. I'll come to the other two, but it's about overrating some duties or overvaluing some duties, because I think part of the challenge here is that there are some duties that are probably seen as a higher order. So like jobs, doing jobs and paying taxes is probably sort of, because that's also often the most common duties you hear. So if people is only focusing on those kind of duties, then one fails to see the kind of value that people bring to the broader the nation, but also the communities, the families. So I think this sort of weighing between duties that might be a bit overrated and some that might be undervalued, I think could be helpful in terms of appreciating duties. And then the last thing, I haven't said much about it, but this is around policies that could support duty bearing. So basically trying to break some of these structural barriers that I mentioned, that I also think could need some more work. And that's basically what I had prepared.
Thanks so much, Marianne. And that's an interesting, conceptual platform to probably launch into Isabel's talk, but also to follow on in our discussion. Many provoking kind of comments there. So I'm going to hand over first to Isobel, and then we will open it up thereafter. Thanks, Isobel.
So thank you very much. My name is Isobel Frye, and I am the founder and executive director of the Social Policy Initiative. And the presentation I'm going to be talking about really is looking to, in fact, it follows on really well from Marianne's paper, and it's looking at the question of the role of pensions, state pensions, for older people, and looking at potential reforms around that. So this is also the other thing. There we go. Just going to briefly introduce my institute, the SPI, and then look at the state of well-being of older people in South Africa, pension utilization and household support, and then a critique of the current state of social services for older people, just looking at two critiques that really have been sort of leveled most vociferously, and casting quite a critical eye on future planned reforms, and then just the conclusion about things that we could be looking at and working on, and then having the discussion. I have to apologize that it is very South Africa specific. That's where my data is. So what is FI? We are a feminist social security think tank based in Joburg. We were started in 2007. And initially we started working on poverty and inequality more broadly. Sorry, this time of day, there is a person, it must be a guy, in a car that drives around with a huge exhaust. So if you hear that, there's nothing I can do about it. So as I was saying, we started working on poverty and inequality more broadly when we started. But the longer we worked, the more we realized that the most direct way in South Africa of reducing poverty and sharing growth, because of the high levels of unemployment and also the apartheid policies that robbed people, the majority of people, of land and assets, really was through the tax and transfer of social grants. And so again, it links very well with Marianne's view of a sort of question of duties and rights. But social security, just to touch base on definitions, as used in this presentation, is made up of two legs. So the social insurance, which is contributory, and the non-contributory social assistance or cash grants. The reason why I mention that is because if you're trying to look with a comparative eye on the social security policy in South Africa, which in Section 27 of the Constitution is guaranteed to everybody, both social security and social assistance, it happens for older people, the bulk of that, and I've got a table that looks at that, is social assistance, which is tax funded. And that is because of the incredibly high levels of poverty amongst older people in South Africa. Other sort of global northern democracies, industrial democracies, have systems where people contribute over their working age some kind of social insurance, which then translates into a social pension at the end of the day. But for the majority of South Africans, that wasn't possible. It wasn't put in place. And that's one of the question marks, I think, for future reforms. And then just finally to say that, in a way, Marianne, this might be an indirect kind of duty. But there is a lot of literature that shows that there is a growth stimulus that comes out of the spending of, or the distribution of social assistance grants to the poor, because of the marginal propensity of the poor to spend all of their income. And so what we're looking at is not a charitable situation of tax-funded pensions. There is a right, but it is also an economic lever in terms of the distribution of income in a country. And South Africa is has the highest inequality rates in the world. So it is something which is not insignificant when you look at policy. So just looking at the state of well-being of older people in South Africa. In fact, I made handwritten notes, which I can miraculously read before I heard Marianne's presentation. But one of the, in addition to the Constitution, one of the popular reasons given for why South Africa pays an old age grant out of tax is really the recognition of older persons' contribution throughout their life to society. And it's a recognition and a reward for people who are not able to provide that for themselves. Who are we looking at? I always like knowing. If you just look briefly at this slide from people aged 60 onwards, we can see that it is dwindling population, but also the third column shows that there really is a much higher distribution of women than men. And one of the aspects that of the social grant, I'm just keeping an eye on the time, social grant policies, is that until about 10 years ago, pensions were paid to women at an earlier age than men. So men got state pensions at the age of 65. And the argument for that was that women pensioners, older women, tended to use their pension for the whole entire household, whereas men, and I remember the line in the reports, they used it for tobacco and alcohol, boxer tobacco, which is a kind of rolling tobacco, and beer. And so there always is a normative aspect to this, but there's also an additional burden that rests on the shoulders of older women in our society. But we can see that there is also numerically, women tend to outlive men. And so just looking at questions of health and socioeconomic well-being, older South Africans face chronic health challenges, which is often exacerbated by limited access to healthcare and support services. That's which is worse in rural areas where clinics are far more spread out and also tend to be understocked in terms of the kinds of medicines that they have. And because of the very high levels of poverty that I mentioned, there is also an experience of age discrimination and social isolation, which leads to poor mental health and a diminished quality of life for many older people. Marianne made mention of the kind of skipped generation, which is comes under household support structure. Older people are often primary caregivers because of high unemployment of younger members, which shapes household structures. So just to explain that, what you often get is that in rural provinces, the children, the middle generation, go to cities to look for work, leaving older people to look after the grandchildren, essentially. They might or might not receive the child support grant, which is intended for the child. Sometimes their parents keep it in the city. But so you have this expectation, really, that the grannies will look after the grandchildren, even if they don't have enough money to do that. So there, that last point, almost 30% of older persons live with 3 or more dependents, and that really strains financial resources, with a 42% unemployment rate in South Africa, Seldom is there someone who has more income in poorer households than the old age pensioner. If you're just moving on to pension utilization in household support, this is an interesting slide. So I'll explain the income sources. The state old age pension is the one that we're talking about. That's the tax-funded one, and its value is 2,080 ZAR. Sorry, I didn't convert it, but £1 is about 19 euro, about 23 pounds, and about $21. It depends when I last listened to the radio, if that's true. But that's the general conversion rate. So state old age pensions, 67% of people have this as their primary source of income, or main source of income rather than primary. 15% of older people have private pensions or savings, which is really, really low. The average monthly level of that in that category of people is between 5,500 and 10,000 rand. So you can see that's much higher than state old age pension. There are still people who report income from employment, about 10%, so it's very low, but that's between 3,500 and 8,000. So again, very low when you consider that income in the highest income decile on a monthly basis is about 24,000 rand. So it's not a source of high income. Family support, remittances, and then older social grants, which is really the disability grant, which is also 2,080. They are the child support grants, which are just over 500. But there we can see that the greatest dependency in South Africa of older people for income is the state old age pension. So the old age grant serves as a critical income source for older persons, but its use extends beyond that individual. Studies reveal that pensions sustain entire households. And here it's important to recognize that these are essential. So food, healthcare, transport, and school expenses for children. The National Income Dynamics Survey of 2021 found that about a third of the old age grant is redirected to household expenses. So that significantly dilutes its direct impact on the older person's well-being. So it's an argument as to whether the old age pension is significantly higher than the other grants because of this additional expectation of its allocation. But it certainly means that the ability of the old age person to enjoy the full extent is significantly diluted. So our upper bound poverty line currently this year is 1,634 rand. So we can see that the pension at just over 2,000 rand is higher than the upper bound poverty line. But it is a question of rights and needs, I think. And then the impact of financial dependency. It means that older people in South Africa often compromise their own personal health care or access to nutritious food, which leads to poor health outcomes, often based on a lifetime of poor nutrition. And then looking at the question of beyond the pension, the current state of social services for older people. Oh dear, I really didn't time the timer very well. I put it on an hour and not 20 minutes, sorry. But if you could just let me know.
That's fine, don't worry, time.
Okay, great. So in South Africa, we find very limited social support services. And our Department of Social Development's white papers on older persons have highlighted the insufficiencies in social support structures, particularly again in rural areas. And I've mentioned that healthcare access is poor and elder care facilities are scarce. About 20 years ago, I worked with an organization that provided older care in South Africa. And there was a huge push to try and get things like luncheon clubs set up so that older people could have spaces where they could, there was a congregation just for social support. But those were quite significantly cut back with budget cuts. And just on that, we have one national department, so we don't have a distinct department for social security and social development. We have one. So because of the need for cash transfers, there has been a significant depletion of the support for social services. And so that the second bullet point there, older people often rely on informal caregiving in households due to a lack of professional services, which increases pressure on family members and can lead to quite significant breakdown of relationships within households, leaving the older person more vulnerable. And in fact, often the pension is the only negotiating tool that they have. So that's on the one hand is limited supply, but also going back beyond that to the inadequate policy implementation. So we have an Older Persons Act, which is progressive, but the implementation is stymied, again, due to bureaucratic delays and underfunding. According to Department of Social Development, less than 40% of budgeted elder care programs reach rural populations where they are, needed most. And according to a critique of Marianne's University of Johannesburg, CSDA, they raised the lack of accountability mechanisms in the implementation, highlighting the gap between policy goals and practical outcomes. So where you have a solid foundation of policy, but it's not being implemented. And again, because of the lack of political, the lower political voice that older people have, the question of accountability and also abilities, mechanisms for voicing their concerns is diluted. From that critique, looking at the future, what does the future hold in terms of planned reforms? I think really just looking around the pension plan reforms, we have had for about 20 years a commitment to look at transforming the entire social security system and to look at it on a holistic manner to introduce a national social security fund. But a lot of that keeps on getting stopped for a variety of reasons. So you have piecemeal piecemeal social security reforms. There is a plan to restructure the old age grant to address inflation and to reduce household dependency, for instance, through the introduction of a conditional grant for working age people. But this is still under discussion. So within the policy terrain, there is a sort of pushback on giving cash benefits to unemployed people, saying that it should be coming with a requirement that you sign up for work. And because of that whole debate, that's one of the reasons why the broader reforms are stymied. So the need is to look at ensuring that other people in the household have independent sources of income, and also, of course, indexing the increase to the annual increase to the grant to CPI headline or some kind of inflation target, but that still hasn't happened. And in terms of the healthcare and social care services, there are planned reforms which include expanding geriatric care within ODIA. I always get this wrong. Public health care and increasing community-based support programs, but analysts have highlighted concerns over a lack of specific funding timelines and actionable frameworks. So a lot of talk, but very little concrete and enforceable costed time frame. So there is just a huge concern about competing budgetary priorities for the implementation of these reforms in a country with huge inequality, but also competing concerns. I've just added this because I was interested. I was doing some work on the African treaties, the human rights treaties, and it's very important to note that on a number of charters, and starting with the African Charter on Human and People's Rights, on the rights of older persons in Africa, 2016, there's also a similar charter on people with disabilities, because often older people have additional disabilities or also care for their children and grandchildren with disabilities, particularly their gender equality and women's empowerment. So looking at safety nets and social assistance programs that target women, so older and younger, but also those living in rural areas, living in poverty. So ensuring that national governments not only ratify treaties, but also implement them, and that civil society pressure groups use reference to these when engaging with government, I think is a really good idea. So the AU Agenda 2063, which is the Africa we want, which was adopted in 2015, in terms of social assistance, advocates for social protection systems that ensure economic and social inclusion, particularly for vulnerable populations like women, children, the elderly, and people with disabilities. So we do have the scaffolding on which to be very proactive in terms of campaigning for delivery, better delivery. But then in conclusion, South Africa's social policies for older persons, while well intended, require significant improvements in implementation and funding. Household dependency on pensions demonstrates the need for greater socioeconomic reforms, such as universal basic income, to ensure that pensions can be used exclusively for the benefit of the intended older person. Thank you very much.
Thanks, Isobel. And actually, thanks for the trajectory of the work, because I think we'll probably end where you ended is I think perhaps where we may want to pick up. I'll open it up to questions before I launch into one or two of my own. So if anyone has a question, please put up your hand or just speak out, because I know sometimes the hands don't go up. So feel free to do that. I'll give it a minute or two. Katie, I see your hands. Maybe we'll take one or two. Katie, you can go first. I'm just gonna, and then I'll see if anyone else puts up their hand in the meantime. Go ahead. Thanks.
Yeah, thank you so much for these presentations. And I'm not sure I have a question yet, but anyway, so I have I guess a comment for Marianne, and then maybe a question for Isobel. I like your discussion of duties and rights. I have thought of duties as a kind of obligation in the context of family care. And the temporal aspect of obligations and rights is pretty well entrenched. I mean, that can be, and I'm talking mainly from my research in Ghana, but a sense of what people have given over the long term, although sometimes grandmothers seem to be propping up their rights through the care of grandchildren, in a way creating a right that is more in people's memories, right, rather than something that they did before. And what that results in is a kind of a negotiation over whether people have done their obligations in the past. And I think of generalized reciprocity as a stance of to each according to their need and what they can give. And in that sense, then men are in a way discriminated against, or because men are seen as having more, they should provide more. And so when they come to be older, then this is when children remember the school fees that were not paid in the past, whereas the mothers who maybe also didn't pay school fees were seen as scrimping and saving in order to try to do so, or to take on menial tasks. So it's interesting how I think that sense of then the calibration according to what people can give, it becomes quite fine-tuned, and in which people on both sides are negotiating about it. So I was just thinking about kind of what a rights and duties framework maybe gives us or puts us into a space, which I think is happening for states as well, but just at a different kind of level. So that's just a comment. For Isobel, I've been thinking a lot since I'm in Canada. I've been thinking a lot, which has a complicated pension scheme, and some of which is contributory and some of which isn't. And Ghanaian older migrants who are living in Canada are kind of running up against the fact that the non-contributory parts of the pension have greater stipulations, and primarily in preventing them from moving back to Ghana and still receiving the pension. But it's made me think about maybe these rights and duties in a sense that from the state's perspective, the contributory part of the pension, the duty has already been met, and whereas with the non-contributory social pension, it's as if there are other obligations that are put onto it, right? And I just wondered if that's all. So I just began thinking about whether that's true more broadly, globally, of whether contributory pensions are in a way more open, whereas non-contributory, where the social pensions are more onerous. And I just wondered what your sense of that was from the South African context. So thanks.
I don't see any other hands. My kind of questions are a little bit off this exact area of question. So perhaps you want to respond to that, and then we'll take another round. Marianne first.
Yeah, thanks very much. I think it was a nice reflection. It at least made me think further, in the sense that when you talk about negotiating and each to their own ability, but what I heard in your example is also how hard one is trying. So with your example about the school fees, right? So it's also, yeah, it gets fine-tuned in terms of how we weigh it up. But even just having more of a conversation around it, I thought, I mean, I don't know whether that kind of conversation is played out anywhere. And it also, I mean, I know this was the question to Isobel, so I'm not going to answer it, but I do think the other thing that you made me think further about is the distinction, obviously, between the contributory and the non-contributory. Because the contributory is more like almost, I think in the article we call it the can't remember, specific exchange or something, you know, it's more like one-to-one, whereas the generalized exchange would be this into the non-contributory. But yes, what is the expectation then? Yeah, so I liked your comments. It just, at least for me, it helped me to think around this framework in more nuanced ways. So thank you.
Thanks very much, Katie. And yeah, again, a nice question. Really, the contributory pensions in terms of social security policy are really deferred savings. So the worker works and contributes, 7%, and there's an 8%. There's a co-contribution from the employer. And so that is a deferred entitlement to your own income, whereas the non-contributory is paid by the revenue. And I think that we must also just be mindful of the difference between eligibility criteria and conditions. So it is an interesting question whether a valid eligibility criteria, given that it is possibly a recognition of a poorer older person's contribution over their life, is not that they have to stay in the country that is paying it. But they are entitled to continue to receive it. I remember hearing headlines about British older persons who didn't, their pension wasn't being pegged and increased. So I was like, well, why are you still getting it? But because there is another theory of entitlement. Conditions are always very messy. I'm of the school that doesn't like conditions, and they generally are placed because the middle-class taxpayer doesn't trust poorer people to use their money in a wise way and wants to ensure that they go to the clinic, that they do X, Y, Z, in a way that salaried people are never expected to declare. But so I think that is something, as I say, nice in the sort of sense of a very sort of narrow and particular question about the eligibility criteria. And I think if you look at people living in regional settings like the European Union, and something we've been pushing for in the AU, but it hasn't yet gotten that. If you cross over into a broader political and economic kind of collection or gathering of states, should your benefit be portable across borders? Yeah, so thanks.
You know, I've worked in customary law. I've worked in a very dominant human rights kind of framework and thinking in previous work. I always wonder how useful it is in these contexts, you know, and I say these contexts, not just in the elderly care sector, but in Southern Africa more generally, or in certain parts of the world. Because even Marianne, when you're talking about, there's that idea that you have paid your duty, you've done some duty, and you have a right at some point to receive entitlements for whatever they may be. In, let's say, South Africa case, it might be the state pension, like the older person's grant, and then that right is there for a whole range of historical reasons, needless to say, but also because they understand there is a value system that you have paid your duty and now you're being repaid or given, it's your time. The whole thing, so that's okay when we talk about pensions. I think there is a kind of consensus in South Africa. It's a political consensus, a big political nightmare to take away pensions, but there hasn't really been a conversation when the minute the increase in population of the elderly sector increases, which it is rapidly doing, that it won't be sustainable, and conditions, Isobel, will come in at some point soon. And I think it's sooner rather than what we kind of imagine. But if we take different types of rights, because a pension is obviously one, we're just using examples, but one we hear in the global kind of world of elderly care is this aging in place, or to live independently is a right, and South Africa has, and we've just been talking about this in some of our work, that we've been doing in our program. It's in the Older Persons Act in South Africa, so national legislation is on it. We have a right to live independently. Older people have a right to live independently. It's ratified under a whole range of UN conventions, including conventions on people living with disabilities. But how feasible is this? The question is, how feasible is that right? So the right's there, but we know it's not realistic. And Isobel, I don't agree that it's only implementation. It is obviously a huge part of this is that the rights are poorly implemented. There's fantastic policy, there's brilliant policy development, but the implementation is the problem. But I always wonder, are we not starting on the wrong footing? So, whilst, first of all, I asked the question, and I think this will come up with pensions in the coming years, but how feasible is it to have kind of rights like things like aging in place when we know the environments where old people live in across Southern Africa and other parts of the world are pretty dire, right? So the idea of living independently is completely nonsensical. And is that a problem with how we're is there an issue with how we're imagining, and how we're thinking about policy? So the issues we're seeing with policy, I think we're thinking of the solutions in ways that aren't actually not just realistic, but I don't think they are attending to the issues in the right way. Now, I know that's more of a comment and a kind of a flurry of ideas, because in the elderly care sector, we have a range of conventions. The list is long. You showed a couple of African Union or frameworks, and that list is also long, goes back over many years, and you could spend a lifetime just doing a review of all these different conventions. Is this the way the problem and the solution should be imagined? I want to put that out to Isobel first and then Marianne.
In answering it, I'm going to focus on the pension, because I haven't done work on what goes into a right to live independently, and there are huge questions around that. I think it does depend. It entirely depends on your perspective and on your positionality. I think if we look globally, that since the 1950s, the share of income has shifted dramatically from being public finance to being private. So there's been kind of a narrowing down of the commons in favor of private ownership of surplus. And with that, we have seen, of course, and then that translates into the smaller taxes being paid, and an austerity budgeting in many countries like mine around the public goods. So public goods are really being squeezed, and so the alternative is to buy private. And if you look in South Africa, I don't have the slide, I was looking at it earlier, but the per capita spend in terms of the tax rebate for private pensions. So as an employee, I pay my contribution, and so my taxable income is reduced by that amount. The per capita rebate for that is greater than, on a monthly basis, is greater than the pool of money being spent on older people. So I think there is a contestation as to where the money comes, where it goes to. South Africa, unlike many other countries, and I can share that slide by Monday. I've now been looking at so many different sources this morning. South Africa has a very youthful population. So I think in other countries where the population is aging, it has its own set of questions. So if we had full employment, we would be, with our sort of youth bulge, really not being in a problem of not being able to afford pensions, because the working age would be paying for those who have retired. So I think it comes down to questions of poverty and unemployment in a significant way. And as the current workforce ages and is not being replaced, that's another and a huge debate, but it's really significant. But then the other point that I wanted to say is, often when I talk to engage with policy makers, the assumption is that Social Security is charity. And I think we need to really critique that. That was the point that I made about it being an economic policy. And if you look back to the good old welfare state, which I love, as you can tell, the idea of Social Security was to regulate the flow and distribution of income in a sort of Keynesian way, so that there is demand that is going, and it's not being stored up as idle wealth by the richest sort of 10% of the population. So that tax and transfer, I think, we should not underestimate how significant that is in terms of keeping the economy going. And then the secondary points that come from it, and there was what's his name? Stefan, I'm sure Marianne would remember his name because he's Swedish, which is kind of like Danish, but not quite. A doctoral student who published on the pensions in the Eastern Cape, which is a rural province in South Africa, and how on pension day, the entire area around the pay point it flourishes, it blooms, and produce is brought. There's a new marketplace basically on that day. Things that people have created, crafts are sold, produce is sold as well and bought. And so there are ways in which in society there are second tier benefits that come from it, which also should be costed in. That is my take.
Marianne?
Yeah, thank you. Stefan Granlund is the name. He did a study. We are not that many people up here in the call. Yes, so living independently. I also don't know much about it, but what I'm hearing you bringing up, which I think is important, is what kind of rights one that makes the most sense, perhaps, to claim in certain context. And you tell me if I'm jumping too crazy in one direction, but I'm just, what it makes me think around is sort of a lot of the rights claiming comes from obviously human rights, and that is individualized human rights. And also, I think in the self-critique is coming from a Western context. I'm hearing you a little bit coming there, right? Or sort of suggesting that it's nice and fine maybe to work towards this in the Danish context with a pretty strong elderly care and pension system and all that. But as you say yourself, is it realistically? Is the right thing? Are there not other structural issues? And I actually think that's where, now Kati was mentioning Ghana as well, but learning about studies from these other, from different African contexts, where you don't have, so instead of starting with, of course we have to claim rights in a sense, but instead of starting with just saying some kind of ideal picture list of things that comes from this human rights thing, which I think that can be a Western critique of a Western perspective in there, we rather sort of say, what are the realities and how has it worked? Because I was also hearing Kati mention this about how by caring and by doing things, you also can gain certain rights. So the grandmothers I was talking to was, obviously they have to hope that that's going to be true, but I was sort of hoping that the children they're looking after would also be looking after them, right? So it becomes a reciprocity at a community or even within a family level, but that's also one way of looking at it, so that this sort of independent, I mean, it's very individualistic, right? And even sitting here in Denmark, I'm sometimes wondering whether things are becoming a little bit over individualistic. I mean, where's community now? Even more now with the social media. So yeah, I think it could be, and yeah, using studies and studying more studies and research, seeing at, you know, what are the kind of benefits or the way that people are able to negotiate care and protection, and are things that one should strive to help them achieve, and then rather do the rights through that way. That doesn't sound easy, but I follow your question, I hope, or at least I feel I do.
No,
Thank you.
Thanks so much to both of you. Adelina, fire ahead.
Yeah, so just reflecting a bit on your last comment, Elena, and the answers, and from a perspective that's not coming from work in Africa particularly, but looking at different countries in the world at the moment, I'd say that this is very much a shared challenge in the sense that the welfare state has been created, care didn't make it in the initial wave, and now the door is kind of a bit closed. You know, we're already losing some of the things we had achieved, and it's difficult to add a new one, or not that care is new, but in terms of responses from public systems, it is kind of new in many parts of the world, even in Europe, in some countries, but maybe I was just a bit thinking about the language you were using, Elena, and I mean whether maybe when we talking about aging in place doesn't necessarily mean individualized care responses, and I think it's very important to consider that the shapes of care in the African context will be very different than what has been developed in the West, because if it's going to start from what people want and how they perceive themselves in the context of the community, we're going to be talking about very different shapes. And the financing systems that we've developed in the West, I don't think respond very well to this more community-based, more locality-based standards that I think that need to be developed. And I do think that there's a lot of creativity needing to look across all the different areas of social protection, social security, and seeing how they come together in care. So it's more of a comment than a question, but I think it's a very important point.
Thanks, Adelina. I mean, when we talk about obviously aging in place, we don't mean, in any shape or form the independent nature of that. It's a community based in itself. When, and a lot of our work is showing, when the basic building blocks of water, electricity, and sanitation are so problematic and tricky, then to even get to the next stage of care, to think about care as is like a second tier of a striving to support someone who has, full-time care needs. Katy?
Yeah, I'm responding to your question about why rights, and is rights the right way to think about it, and thinking about the contradictions in Marianne's focus group, in which on the one hand the pension is mine, right, a kind of a right, and yet at the same time the sense of, well, I need to take care of my grandchildren, right? And so I was thinking about how older persons are so quick to refuse care, or to think about, well, no, I actually want these resources to be going to the young people, and denying themselves medical care, for example, are in a way making the kinds of decisions that you're talking about how many resources are there, but then they are often doing so to their own detriment. They're making a value judgment about the young people being more important, which may be completely, I mean, they're making that determination. But then those rights might also be important in a way for shoring up, or creating at least some place for them within those negotiations that are happening within the family, so that it's, anyway, it's a rights-based discourse that is also happening within these family negotiations. And so maybe in that sense, it's also important just for shoring up some valuing of the older person. Although there are other discourses that are also happening, not just from the level of human rights, but about previous gifts, previous exchanges, about affection is certainly taking place as well. But I wouldn't want to get rid of a discourse of rights either, even if it's individualized, perhaps. And I think it's happening alongside these other frames in a way.
Isobel?
This is a completely left field comment, but so when I was just listening to Katie talking, sorry, is it Katie or Katie?
Yes, it's Kati, short for Catalina.
Kati. Great, Kati speak. And the contradiction in Marianne's study, I find that with my 18-year-old daughter, who expects me to spend my salary on her in a way that I have never anticipated is her entitlement. And so I think that exists across generations. And I was just laughing because I had a conversation with her this morning about when you get a job, etc. So she is my dependent, like the others are our dependents. And my reaction would be like those of older people, like this is my entitlement. And yet, because of the bonds of reciprocity and duty and obligation that you will. Sorry, that just came straight home in my conversation this morning at home. So.
Yeah, and I mean, I think in South Africa, the rights discourse has gone very far. It's gone very far towards children, for example. It's gone for women in particular. It's used, and it's strategically used, purposefully so, and rightfully so. And it's like materially and discursively, it is a source of power. And I think obviously for older persons, it is too. But then the international community, the rights are long, the list is long, and there's many rights, and many of them are not feasible, or at least even aspirational. And then you begin to wonder where this is coming from, or maybe they are just aspirational. Marianne?
Yeah, I'd be curious to talk more about the rights actually, but I just wanted to bring it back into this sort of the family perspective that Katie and Isobel is also touching on, because I also wonder whether there is a specific challenge for elder people in that within the family, that since they're the parents, I mean, sadly my parents passed away, but I think it took me a long time to realize when they were actually becoming old, right? So there's this challenge for elderly people that people, or I can only speak for myself, but I looked at my parents as being able to do all sorts of things, and they were actually getting pretty weak by the time I realized, hey, the table has turned, right? And then I think Katie is right about not saying, not thinking about others first before themselves, and therefore it comes to that detriment, because everyone else is so slow at realizing it. But I don't know. This is just within the family. I think there's a different, interesting dimension for that is further challenging this position of the elderly. But I think the rights list, I think there's something useful. As much as I'm totally not against rights, of course not. But I think we could have a bit more provocative thinking about it, a bit more provocative discussion around daring to touch on it. I think maybe there's time for that. Thank you.
Yeah, I think it's a lot about how you how you respond to the rights, what are the mechanisms and how they look in different. And I keep thinking about that sometimes we might take quite a narrow look to how a right is met. And it's almost like an absolute yes or no. And I think thinking about care, which is my area, there's a lot of gray, so that maybe is harder to capture and to.
Yeah. Isobel?
Thanks. I hope you're okay with continuing to kind of tease out some of these things. South Africa is an interesting country to live in because we have lots of different cultures, and we've had historic ways in which those have evolved. I mean, the migrant labor and the displacement of people into homelands or Bantustans was significant. But I mean, it's interesting that amongst friends of mine who are not Anglo-Saxon in historical family, the idea of putting your parent into a care home is a complete anathema. It's just not done, and there's a sense that you're a really awful person if you do. And so the family extends and embraces and care has a place for people, but at the same time there is an expectation on duties and responsibilities that the older people have. Just small tasks, looking after children, cooking and things like that, and that seems to create some differences, but that creates a sense of purpose and space and role and identity for that person. Whereas in other situations where the older person leaves the family and has an individual living, the question can be asked, well, what is how is there a contribution? I mean, very blandly, sort of boldly to society. And when the expectation is, when there's a severing and it's only looking at past reward for past activities and not future, I think that's an interesting question. Yeah, I've always told my mum I expect her to do childcare. She's like, no, I have Bible study. But so in addition to that, I also just wanted to raise the question of social services, because that is something which in a developing country, because of the reliance on traditional forms of family structure, isn't as starkly obvious as a deficit, I think. And yet with societies changing and that role and that knowledge that the person is in a vibrant society no longer being there, I think that is something to be looked at in future. I mean, the isolation and vulnerability of older people can be extremely destructive, and the mental health of isolation and depression is something which is just not really recognized in South Africa the way it could be. So that, I think that'll be an interesting conversation for future ones, sort of beyond the money. What I very optimistically entitled my presentation was who cares for the carers? So beyond the money, it's an interesting question in a society. I suppose most societies are constantly evolving, but we're moving very quickly from a sort of pre-capitalist formation for many people to where we are now.
And one thing I did want to ask of you, given your experience in the broader field of social security and advocacy and widely speaking transformation, in that field or in that sector, in that area, and I know you've got many years in fighting the fight for, let's say, basic income grant, amongst other things. And, each of the different forms of relief and social protection in South Africa has had their fights. The child support grant had their fights, pensions had their fight to equalize on age, amongst many other things. Disability grants have had many fights with regards to who qualifies. I'd like to hear from you in terms of, if you're thinking about a kind of a rapidly aging population, which we do have, I'm curious to know, how you strategically positioned your advocacy and your interaction with like government officials and political leaders, and your knowing that you were probably going to be up against it for the most part. I don't know if that makes sense. Like, is there, with so many years experience of fighting for a basic income grant and being probably shut down for many, many years, and and the work still continues. It's inspirational, on many levels. And I'd love to hear, like, in 3 minutes, how you did it. No.
When you say it's inspirational on many levels, do you mean to say it's also lunacy on others?
Well, maybe.
I think it really, absolutely, it's not a battle that's going to be won overnight, and it certainly has already taken 20 years. For me, there is no alternative. I'm an activist as a sort of quite young person that was still at school against apartheid. So I think the question of equality is something which is crucial for me, and it's possibly easier to be called to do in a country like South Africa, where you not only have historic injustices that need to be corrected, but you also are looking at just the vast inequalities between income, and maybe also having a daughter who has embraced this country as a place where she wants to live in future. There are many days where I see the future of this country as not being sustainable because of the high levels of unemployment and poverty. So the question for me has always been, what can be done, and how that could be engaged on. And because of a background of privilege, because of my race, in a way that also just speaks to the fact that I can engage. It takes its toll. It certainly does, and it's never just a job. And after a particularly grueling engagement with the Minister of Finance, for instance, you do think, well, I mean, this is never going to go anywhere. And yet we have seen, so I mean, just taking the child support grant that was introduced in 1997, there was an apartheid grant for white, so-called colored and Indian children, mostly white children though, and very little for Black African children. So in 1997, after the Lund report, it was introduced. And initially that was just for children up to the age of 7. And as the call for a universal unconditional income grant started becoming a demand, so the child support grant got increased. So there was also court case litigation. But I remember in 2003 engaging with then Finance Minister Trevor Manuel, and he said, we have a big, it's called the child support grant. And so there's been a shift on that. Pensions again coming down. It makes no sense that people are deaf to the need for everyone to have a basic income. So yeah, maybe lunacy. But I think we need to, and that's what I was saying to Veda actually, and when we were at Bath at the BN conference, was we do need to celebrate our victories in a much more significant and visual way, because it's not just for us at the coalface, but also I think for policy makers to step back and realize that there have been changes, and then for them to feel good about the changes that have been made, because it should be a game in which everybody wins. And we know that a lot of bureaucrats have path dependency. They don't want to do anything different. They might get into trouble. It's so much work. But if we say, well done to you guys who were in office in 1997, look what you did, they can feel good about that. And in fact, and I know people do, the Deputy Director General in Treasury said, who was in charge of the social relief of distress, which for others is a COVID kind of instigated working age cash transfer. She said she goes home to her rural home at Christmas, and her mom says she's the one who pays the 370, the 350 grant, and everyone's like, wow. So it's hard for it not to be personalized, but it can be. It's also very rewarding. Okay.
Thanks, Isobel. Are there any other comments, questions, queries? I don't see any hands. I don't hear any voices. And I know it's almost 4:30 on a Friday, and in Cape Town that signals home time, and probably in Johannesburg too. And so I think we can call it a day. And I'd like to first of all thank our speakers, Marianne and Isobel. Thank you so much for sharing your time and insights with us. I really appreciate it. I'm sure everyone does. Again, thanks to Adelina, Naz, and Anya and the team, the GOLTC team, for facilitating this as well. And to just look out for the next year, 2025. Can't believe we're saying that already, but the 2025 seminar series will be probably set up fairly soon. And we look forward to having another round of interesting interesting series of seminars on elderly care, social protection, and in the region. Okay, so have a nice weekend, and thanks everybody.